When it comes to addiction, what people may not know is that relapse is almost always part of the recovery process. The people at Mount Regis acknowledge this fact and help individuals walk through the relapse prevention specialty track in order to help them not make the same mistakes again. Bill Harris explains what this track is and how it can help those in need.
Well, our relapse specialty track focuses on identifying stuck points in early recovery efforts, primarily from individuals that have had recovery in the past.
Okay.
Does not preclude anybody else from being a part of that group, but we really kind of review the developmental model of recovery, which we talk about 6 stages of recovery, and during those 6 stages people do and will periodically get stuck. And help them to identify those stuck points and how to manage them.
And a lot of the hard part about having an addiction is admitting that you have that addiction and then getting help and then not relapsing.
Well, it's sad to say, but, relapse a lot of times is actually considered a part of the recovery process because most people who try to stop drinking and drugging initially, they can stop. But the concern is staying stopped. Most every alcoholic or addict during a period of their drinking or drug use career or life has stopped. The problem is being able to stay stopped. So what we try to do is help them with that.
And what are some things you do here at Mount Regis to help through that process?
Well, initially we have to have the patients do a very extensive addictive use history, when they began drinking and drugging. Honesty is a big part of that. When did they start? How much did they use? When did they use? Time frames. So you can see the progression of what they used, when they used, and how it significantly impacted the developmental stages growing up, depending upon if somebody started smoking marijuana or drinking at 13, maybe a little bit different. Somebody who had their first beer at the age of 21. So during the developmental stages, it can interfere with their developmental.
And we're seeing a lot now, a lot of younger people starting to drink a lot earlier. And does that make it harder to quit when you get older on? Does that make you possibly a heavier drinker when you get older?
It depends. It depends on it's a variety of factors. We look at disease of addiction as a biopsychosocial, spiritual disease. And depending upon when you started drinking, how much you started drinking, the environment that you're raised in, the people that you're engaged with. It's not like, we're not like talking about someone who had a sip of beer out of their grandfather's glass, on the picnic table. So we have to really look at how much they were drinking, how much they were using, and the progression of that.
And one thing that's so great about Mount Regis is you don't let people, have no system of support when they leave here. You always make sure that they have people to kind of continue with that recovery after they go through this process.
Sure. We just talked about that. We had our relapse specialty track group this morning, and something that really comes up in almost every group is the lifestyle change. There has to be a significant lifestyle change. It's commonly said in meetings and in treatment centers, you got to change people, places, and things. And they say that because that's significant. Sometimes people think it's just enough to stop drinking or drugging, but they still hang out with the same people, they still go to the same places, and we know that most of the time that doesn't work.
Yeah, because it's kind of setting yourself up to be back in that situation and around those things and just tempting yourself in a way.
Absolutely. So it's there. As we said, why would you want to do that if you're not going to do that? And it doesn't mean that everybody that does that or has a picnic that has a beer or a couple beers, that doesn't mean that they're a problem drinker or an alcoholic. But if you were here and you're in treatment, so there's something that got you here, and there's a reason that we have to look at that.
And what would you tell people who are looking at a track like this or, considering coming to Mount Regis?
Well, if someone was looking for a relapse specialty track, as we have here, is being open to the things that they're going to need to change. And that's their choice. We can't make them change these things, but I think the people that we have here, the counselors that we have on staff, including myself, the other counselors, that we are able to identify those environmental changes, the things that you're going to need to change in your lifestyle, and make recommendations for you to do that.
And Mount Regis is located on Kimball Avenue in Salem. If you're struggling with addiction and need help, you can call them at 540-389-4761, and you can go online to their website for more information at mtregis.com.